Dear friends and colleagues, this is Deepak Mishra, and today, in this video, you are going to see a guest who is not really a guest, who has been with Deminets since last 4 years, whom you have seen several times on this channel, sometimes through the way of Fachsprachprüfung preparation, sometimes in the online webinars that we conduct regularly. Today, I am very happy to have him as a guest on this channel and learn from him his experiences, his ups and downs, as he has passed his Kenntnisprüfung just a couple of days back. Before that, he passed his Fachsprachprüfung. Between these two, he got 2 jobs. Now, this is not a small feat in a matter of few months. Let's welcome Dr. Nitin and have a conversation with him. I will try to ask him as many questions as I think our viewers would like. This video will be very valuable to candidates who are preparing for PG in Germany, who are already in Germany and who are looking for the path ahead. Please watch this to the end, and you can write your comments and questions that you may have in the comment section of the video. So, Dr. Nitin, how are you? How are you feeling today?
A struggle of 4 years finally came to an end.
Wonderful, wonderful. Congratulations from the team of Deminets and from me. It is all, as I said right now, that I'm very happy to have accompanied you through the entire process. Obviously, the work has been done by you. Your exams you have passed with your own merit and with your own struggles. Everything is your success. Only it is our pleasure to be part of your success, to accompany you through this journey. So, Dr. Nitin, our viewers would want to know your story. That when did you decide that we want to come to Germany? What were you doing that time?
I completed my medicine in 2011, sir. After that, I worked for 4 years in Kerala, in India. After that, I worked for around 7 years in Oman as a medical officer. In between 2015 to 2017, I was thinking like I should do my post-graduation somewhere. Then I searched different options like Australia, UK, and many different things. I even once started preparation for my MRCP, but it was very difficult and all. AMC I did for a few days, and after seeing all the things in Facebook, like no job opportunities, anything, my aim was to do, I was very impressed by my orthopedics HOD in my college. So I wanted to do something in orthopedics, and getting into orthopedics in UK, Australia was very difficult. Mm-hmm. And I was searching, and because of my family problems, I had to support my family financially. I had to work. If I go back to India and I cannot support my family financially, so I was searching, and in end of 2015 and starting of 2016, I came to know much about Germany. At that time, I was in a hesitation, like my parents were saying, "No, you are doing good. You have to get married." And then I fought with my parents. No, I'll wait, and finally I had to marry. Then I somehow convinced my mother to Germany, and now she's in the process. And in between, many things happened, and so a little bit delay on her side.
Mm-hmm. So, yeah, I understand that in Indian families, getting a son and or a daughter married is one of the biggest biggest task that the parents have, and especially if the child plans to go abroad. So that is also one concern. Here, you talked about your family. So could you tell us more about your family? Who are there in your family? What are they doing?
My father is a retired lecturer and mother is a retired teacher. And I have a sister. She has done PhD in organic chemistry, and she's near to a scientist now.
Oh, okay.
Yeah, and my wife is a doctor.
Mhm.
We got married in 2017, and we were both working in Oman. I was getting a good salary, but there was some hesitation in my mind, and it was like something is missing. So I was always thinking of doing a post graduation. So in 2016, I was about to start preparation for Germany, but because of this marriage and all, I started it around in 2018, I think. Yeah. After
Okay.
my marriage, everything got set. I had again restarted my struggle to take up the thing to do PG in Germany.
That you said very nicely, that after your marriage things got set. That means one gets perspective after getting married. Okay, now things are not fun anymore. One has to do what is
Yeah.
required and take the leap. All right. So yeah, I mean, this is very interesting and also very difficult decision to make, that having a stable job, because I hear that in Oman they pay really well. So having a stable job, getting a good salary, leaving that for something which is unsure, which is uncertain, you don't know, it might succeed, not succeed. That decision making itself is a quite difficult thing in my view. Was there any resistance from your family about that?
There was no resistance from my family side, but financially, once to get married, we have to build a house, we have to take loans, and to set everything, it was a little bit challenging, but I had to work overtime, everything, and I had to do some hard jobs like working in a oil field jobs and all.
Mm-hmm.
And I had to do because I wanted to do something. Like
Mm-hmm.
I want to do my post graduation, so the there were no hindrances from the family, but there were some financial problems and some personal problems which I cannot explain here. It's like
Yeah, understand the entire package. It's not only about the willingness. I mean, the family is saying that, okay, you go. But then the other circumstances should also be in that position that one can say that, okay, good, I can manage and I will go. So I understand that totally well. Tell us about your job in Oman. Like, what kind of job was it? And did you learn things over there? That is important.
yes, sir. I was like, I went to Oman in 2015. For around 2.5 years, I worked as a normal general practitioner, like seeing the normal cases and all. Like I wanted to do something new, and then I got an post of an occupational medical officer in a oil company, different oil companies. Then with a improvement in my salary package also.
That we are
So
going to ask just but after you finish.
yeah, and for that thing to do the occupational thing, I had to do some occupational health courses like NEBOSH, IOSH, and ITLS, which was very important for that. International Trauma Life Support.
Okay.
In Oman, there was a rule like I had to, every 2 years we had to do ACLS, BLS, and all. So it was like emergency management was very. I was like I was pushed into that side along with occupational degrees and all. So I had to do all those things and these things also.
Oh, okay. And now the question about how is the pay package over there? Now that you have left it, but still, how was it that time?
It was very good actually. There was no reason to come to Germany if I was comfortably placed there.
Okay, but just to learn and just to do your post-graduation that you had in your back of the mind since so long. Because see, in India, I totally agree that there is everyone is doing post-graduation. All your friends, your colleagues, everyone is doing. And you hear that, okay, I mean, just MBBS or without that additional qualification, it's like basically you have achieved nothing. Ultimately, in my view, degrees don't make it does not add to your achievements. It's one milestone one can see, or like self-satisfaction that I have done that, because I'm almost like around Fakats, and I feel that okay, if I get that, then what will change? I mean, nothing much will change in that. So this will happen to you 6 years down the line, that you will feel that.
It was uh, not like what you said now, sir. But I was like, I had to do something. Like working as a medical practitioner, I was not seeing to the end and management of the patients. I was a little bit unsatisfied at that point of time.
Okay.
So I had to.
Okay, and understand that's a very good perspective, that you were not you were just like you were seeing the patient and referring further, and you're not treating the
Yeah.
patient to the end. So that is
Yeah.
that shows your commitment to patient care. So I'm sure during your interviews in Germany, when you have mentioned these points would have like played a very impactful role from a person's psychology, that how dedicated this person is towards patient care. So yeah, all right. So this was about Oman. You did not tell us the salary structure over there. A rough idea, just for the idea for our viewers, that okay, they know that there is an opportunity, there's an avenue.
Yeah, to be frank, like in the first 2 years, I was getting around 2 lakhs per month. And with my all the courses and things, I was getting around 3.5 lakhs per month and all.
And how is the tax system? How is the tax system?
There is no tax. There is no tax there.
Wonderful. So all you like earn, you save, plus the living expenses that you have there.
Accommodation was provided by the hospital.
Wonderful. What more does one want? Yeah.
So, yeah. Right now, also I get a lot of calls from them to come back.
Now, once you get to the system here, I mean, later on, once you become Fakats here, definitely you can go back and then earn much better packages than what you were earning as a.
Yeah, that is my future plan, sir. Actually.
Yeah. No, that is that. I mean, once you start living here, you don't want to totally move out, but just because in Germany, the earnings are always capped basically, and you all have so much taxes over here. So you always have that thought that okay, to earn money, let me go outside, work a couple of years, get some money and come back. Okay, but for totally moving out, I mean, I don't think that people want to move out from Germany, people who live here.
Maybe down the timeline I will also do that.
Yes. This has been my experiences last like 6-7 years now. All right. So we talked about your decision making towards Germany. Now tell me, how has been since when are you in Germany?
From December last year, I am in 2021. I am in Germany, sir.
From 2021 December, and we have now June 2022. So 7 months in total.
Yeah, 7 months.
7 months total. You came here for Hospitation, right? Hospitation, you did. You passed your Fachsprachprüfung. You got 2 jobs. You got KP. So you did it very fast. Was there any secret? Why? How could you do things so fast?
It was not like a secret, sir. You guided me in the same way. Like coming to Germany is not that the main thing. Doing things faster after coming here. That was the aim. That was you telling me from the starting what to do. That is what I followed blindly your instructions, whatever you said, because you are in the field and you know what to do. So that is what. I followed you, whatever you said.
Thank you, Nitin, very much. I'll send you the check that we discussed about this positive review.
No, it's not like anything secret, sir. That is what happened. That is what I am saying.
Yeah. So okay, yeah, I'm very glad that things worked out so well, and you think that my guidance helped you do things in a better, more organized fashion. So. You joined us. When did you join? That was in the beginning phase, I think 2018.
2018 January, I think, sir.
Yeah. Okay. Yeah, and after that, I mean, the duration was that because I understand, I didn't remember that you were doing 15 days on ship job, 15 days outside, so you could not take the classes regularly, and everything was like prolonged, and that is why it took so long, and then also the personal situations that unfortunately
Yeah.
happened
Yes, sir.
with you. So yeah, but I'm very happy that ultimately it all worked out. So, you came here for a hospitation. Now, tell us about your experience during the hospitation.
Hospitation was very good, sir. Then there I came to know what the chef arts wanted from the candidates, and my speaking to the people, the, my speaking skills like developed a lot during that thing. There is a difference between India and Germany in regard to the chef arts. The more we speak with them, the more happy they are here.
Yes.
Yeah, in India, like we'll be very hesitant to speak with the chef arts and with the Uber arts. Here, the thing is like if you're the chef arts at the on the last day of my hospitation told like you are not talking with the you have to talk with the Uber arts more.
Hmm.
Like in India, we hesitate to talk with assistants and associates.
Yes. I
That
totally
was a
relate.
little bit,
I
yeah.
totally relate to that because we feel it's as a sign of respect that okay, you talk only when you're asked. You talk limited. You talk only subject matter things. You don't talk about your family things. You don't talk about your vacation that you took. You don't talk those things. But here it's totally different. Here it's like if there is a time is there, if you are in that position, then you talk about those things. They are also happy to have this conversation. Obviously, it depends upon person to person. It's not a generalized rule that every chefs, every oberats will like that kind of conversation. But at least on the subject matter, they prefer that you share more and more more and more input that you give during the interview, during the besprechung, especially when you discuss cases and everything. They appreciate that you talk more and give share more input. So yes, apart from that, else did you learn? You said that the off clearing that you did, the communication increased over there.
Yeah.
It was the hospitation was in anesthesia. So in anesthesia, did they allow you to do anything?
Yes, sir. The chefs was very happy if you do something there. So I did a lot of intubations and a lot of laryngeal mask airways, and
Mm-hmm.
I was like not familiar. I was using a portable ventilator in my Oman,
Mm-hmm.
but in the stationary, I mean the thing which we use in OT and all, I was not familiar.
Mm-hmm.
That I learned it from there, and they were helping me a lot to learn it, and they were leaving it to me to operate it, and they were just guiding me.
Mm-hmm.
It was like just to give anesthesia to a patient. It was like I was given the responsibility for some patients,
Mm-hmm.
and yeah, later I did it for 3 months. The hospitation for the first 1.5 month, I was through these things. Then I was finding it difficult to communicate a complex like discussing case discussions about with my friends like other assistant arts in the
Mm-hmm.
station. Then I went to the chef arts and spoke with him like I want to improve my conversation with the patients and my colleagues, so I want to go to the ambulant
Mm-hmm.
thing where we give the offloading is fresh. Then
Mm-hmm.
he said, yeah, that is a very good idea, you have to go there.
Mm-hmm.
Then for 1.5 month before the my fax pack and perform,
Mm-hmm.
I went to the things what uh, that helped me a lot because like I was with many German assistant arts who were doing offloading express. In between time, I had a lot of conversations with the German assistant arts, native Germans. And it was not like a subjective things, like a normal conversations. Where are you going? How did you make? How are
Mm-hmm.
you earning? Like normal conversations.
Yeah.
Uh, and offloading express, they were helping me. You want to explain the patient? Okay, you do that. And they were supporting me if I find a difficulty, and like they helped me a lot. Uh, they helped me like getting some contacts, like how some other hospitals and all.
Mhm.
It was good. They were very supportive actually.
That is the purpose of hospitation. People ask many times that is hospitation mandatory? Should they do hospitation? All I say that these things, it's not mandatory. But when you do hospitation, you get these benefits, that you improve your language, you learn the system, the activities that you did. It's not very expected that not everybody will be allowed to do things, because hospitation is mostly observership. But since you were experienced, you knew things, you knew what you were doing, they allowed you a little bit more than what they would allow to a fresher candidate. So, but this contact building, that getting to know people, that is very important. That one cannot do learning in the Fachsprachprüfung courses sitting in a classroom. I mean, one can learn that also there also, but on a workplace, learning is much more effective, I find.
Yeah, yes, sir. Yeah, I also have the same feeling.
Okay.
Hospitation is not mandatory as such in the process, but I felt like a language will be improved if you do that.
Yeah. Okay. Now, going forwards, I would like to know about your job interviews. You got a stellar in orthopedics. You got a stellar in anesthesia. You said that you had orthopedics was your choice, your aim right from the beginning. Then why did you apply to anesthesia? What happened?
It was like I was in a confusion, like with my age and all. If I can go through orthopedics and have a independent practice later, and if I want to go back to India, will it become a problem? I was, because my family is in India, and I was in a doubt to take up orthopedics or orthopedics. I thought like if anesthesia, I can go there and work as some intensivist or something. I was in a confusion. I applied for both the things, and luckily I got both the things. Then again, big confusion started.
Yes, I remember we
Yeah,
talked.
then again I called you, I think, what to take up. Then you told me like, we'll wait for some time.
Yeah.
Then I think I look which city is better, and then I chose for ortho, sir.
Yes. See, I always say that you see, branches are almost, I mean, all branches have the pros and cons. So, and also there's a preference, what you like to do. So, if you even want to go back to India and all, even you have ortho, it is not a handicap. It is certainly, maybe you can go to the UK and get one fellowship or something like that, and then everything is recognized. Then you can go to India and practice over there, as a consultant orthopedic surgeon. Obviously, the rigorous activity, the work that they require in orthopedics, in trauma, is much more difficult than in anesthesia. That is for sure. That is true. That you have to put in more hours. Your lunch breaks are not fixed. You have to work physically in the operation theater. So age plays a factor over there, but I don't think it plays such a major factor that one should directly give it up. Like, okay, I will not do it. It should not be like that. That is my personal view on this. All right. So next, you tell us please, about the job interviews. How were the job interviews? Any questions that you remember that you were not prepared for and all?
Actually, after getting the job interview, after your advice, I wrote to the chefs like I want to do one day hospitation. That was not in the scenario in such. Then I wrote to the chefs like I will do one day hospitation. Then he told, okay, come to us. Then I went there to the hospitation.
This you're talking about, sorry to interrupt, this you're talking about the orthopedics, right?
Yeah, orthopedics.
Okay, yes.
He told me to come back or to come for the morning pressure in the morning, which happens. Then I was there in time, and after that they discussed about what they are going to operate on that day and all. There was a presentation by one of the assistant arts. Then the chef arts, I was totally with the chef arts on that day, and I had to assist him in the OT. And he was asking like, what are your experiences? Everything, and I was entirely with him in the OT on that day,
Mm-hmm.
and he was like, how many, whatever, what all you were assisted before, what you can do, what you cannot do,
Mm-hmm.
how are your suturing skills? He was asking all those things. Uh, yeah, that
Okay.
was what all happened, and he observed everything, how I was washing my hands, how I was
Okay.
putting up on my aprons, how I was using my lead jacket, everything. He was
Uh-huh.
observing everything.
Okay. Okay. Okay.
Yeah.
And then did he tell you that same day that he wanted to hire you, or how did that work out?
Yeah, he told me that he wanted to hire me on the same day, but he was supposed to take a holiday for 3 weeks from that
Okay.
day.
Okay.
So it got a little bit delayed,
Yeah.
and I think that helped me because I got a term for my KP in between.
Yeah. 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 Okay. Okay. Wonderful. And then you got your anesthesia job as well. So how was the interview in anesthesia?
Anesthesia job was there was no such interview. I just met the chef and he told, yeah, we will. He asked about where you work, and they told like, yes, we want to employ you.
Okay. Okay. Okay, so basically, seeing your previous work experience that you have accumulated over the period of time,
Yeah,
you had already
there
worked
my
already seen it.
hospitation played a big role because I did 3 months hospitation in anesthesia.
Mhm.
He was more into that thing because I had 3 months German experience in anesthesia.
Yeah, that played a major role. So
Yeah.
that's wonderful. So okay, so this is all. I mean, every step. If one keeps discussing each and every step, one can discuss for hours about each and every step because there are so many factors and so many aspects one can talk about. All right. So now tell us, Dr. Nitin, what is your future plan now? Like now you are assistant arts in orthopedics. You will start in next month, I think, in August, right? In August.
August.
Yes.
August 1st. Yeah.
August you will start. So then, I mean, the 6 years you will have to struggle through that. After that, so do you, now that you have achieved this point, okay, which you 4 years you laid the seeds 4 years back that okay, I will go do orthopedics, I will go to Germany. Now all those things are accomplished. Have you thought anything about what you will do after 6 years?
Right now, no, sir. 6 years is a long time. Many
All right.
things change in between, and
Yeah.
first thing now is like in between. I have 11 months kid now.
Yeah.
I miss her a lot. In this week, I'm going back home for 1 month.
Okay. Yeah. Have a wonderful time with your family, Nitin. Basically, thing is that when you have a goal, when you have focus, then whatever it takes, it has to be done, right? So that is the motivation that has to be there. If you just sit in the comfort zone that okay, life is good, I'm earning money, I'm living with my family, I don't want to miss the time with the small baby, then nothing much great will come out of it. All right, good. So great. This was very nice talking to you, Dr. Nitin. I wish you all the best. And I mean, for me, it was a pleasure being with you, like talking to you regularly. You have been very motivated all the time, and it has all showed up in your work. Like
it's not like motivation, sir. I think I screwed you. Like I was every day messaging you and irritating you, I think.
See, as I mean, that's very kind of you. That you acknowledge that, but you told me that no, you told me this before also, and I told you, see, there are different kinds of individuals, different kinds of people. Some require some guidance in one part, some require another part, and that is why, I mean, we are there. I have chosen it to do that. So. So I'm very happy that ultimately things should work out. That is the most important thing. Yeah, it should not just, all the effort should not go in vain. So that is the things work out. I'm very happy about it. All right. Many of our viewers who watch intend or plan or wish to do orthopedics in Germany in future, or work as a doctor in Germany in future, do the post-graduation in different departments. Do you have any suggestions or any advice for those candidates?
Yes, sir. If they are MBBS people who are going who are planning to come, during that their language thing, experience in orthopedics in some hospital or something, that is very useful for the job interviews and all. During language course and experience should go parallel, because previously, now it is changing in Germany, like those with experience they want more, and without experience, like we are getting filtered out. Slowly it is like becoming difficult to get the things which we want without experience.
Yes.
So language course and
Some work
the
experience is preferred. Yes, I totally agree with it. Only thing is that, see, I get several questions regarding this. Many questions say that should we gain experience in India then apply for Germany? I say that no, don't do that, because the process in Germany is already very long and very tedious. If you say that, okay, I'll work 2 years in India, for example, and then apply to Germany, then you're losing those 2 years, because that experience is valuable, true, but without experience also you can find say not a very good hospital, not a big hospital, a smaller hospital somewhere, and those 2 years you could learn here in Germany. Okay, so that is also one way to look at that. If you as it is doing language and it's taking time, then do short courses, not courses, sorry, short jobs, 1 year, 6 months, something like that. It will definitely show up, because then when you go for the interview, you know what you're talking about, you have seen those things before, so that plays a role, definitely. But one should not wait to gain experience and then plan for Germany.
Yeah, that is what I meant, sir. Like when we are doing the language, parallelly, if we do if we want some desired branch, experience in the desired branch plays a role. Until we get the B2, whatever we do counts.
Yeah, great. All right. So thank you, Nitin, very much for this, for taking out time and sharing your views and suggestions with our viewers. I'm sure viewers will definitely value and benefit from your the things that you have said. And I thank you very much for talking so nice about me and my company. I wish you all the best.
It's not talking nice, sir. You have helped me a lot, and I irritated you many times. I think.
No. Don't say like that. Don't say like that. All right
Yeah,
then.
because
Yeah. You're saying something.
Because I used to message each and every day.
It's okay.
Yeah.
I mean, see, as I said, I'm very happy that things worked out.
Yeah, thank you.
All right, then I'll stop